On this call, we'll have staff from our research, policy, and advocacy teams, as well as a CCR&R. So first you'll have Maggie Norton, who's our research manager and an expert in GIS mapping. She was our lead writer. Then you'll have Jen Bump, who's our senior advisor and an expert on CCR&Rs. She helped us document many of the cases we highlighted. Then we'll have Dr. Susan Savage, who's our director of research at CCRC in California. And she leads a team of researchers who are doing really interesting work analyzing childcare supply and demand. And then finally, we'll have Lauren Robertson, our digital advocacy manager at CCAOA, and she'll help us think about how to use these stories to educate and push for policies to close the supply gap. And I'm going to turn it back over to Maggie, and hopefully everybody can hear now.
Thanks, Dion. So if you can't hear, hopefully we'll be able to troubleshoot. Again, we're really sorry about that. So high level, what we'll be talking about and covering today are some high level themes and notes from the report. Hopefully you've read it, or at least read the executive summary. And if not, this will give you a preview to go back and do that. We have, as Dion said, we have a speaker from one of our members, Dr. Susan Savage, who's the director of research at Child Care Resource Center in California. And after that, we'll discuss the role of CCR&Rs in supply building, the integral role that our members play in this important topic. We'll then transition to some policy recommendations and messaging, and then end with any questions that you may have. So lots of you have already done this, and really thank you. We really appreciate it for entering your organization name in the chat box. If you haven't, please feel free to do so now. So this report that we released to you yesterday is a follow-up to our 2016 report, Childcare Deserts, Developing Solutions to Childcare Supply and Demand. In this report, we featured 7 states or communities, as well as findings from focus groups with parents and a literature review on childcare access. This report laid the groundwork for our Mapping the Gap project, in which we examined the gap between childcare supply and demand in 9 states. In addition to the release of the report, we're also releasing 2 new story maps that are on our website, Mapping the Gap in North Dakota and Mapping the Gap in Idaho. We encourage you to check these out. The focus of this report is on the role of CCR&Rs and partners, such as state-level advocacy organizations, conducting research on childcare supply and demand. Because this report picks up where the previous report left off, we have revisited some of the states that we interviewed in 2016, as well as interviewed some states that we have created maps with, or others that we have worked with through the process. We wrote up these stories in the spotlights in our members-only state profiles. Finally, we highlight ways that policymakers can help close the gap at the federal, state, and local levels. So while our 2016 report highlighted the problem of childcare deserts or childcare supply and demand, in this report, we tried to elevate solutions that CCR&Rs and partners are deploying in their communities. Through our conversations with CCR&Rs and partners, we have learned about and elevated several trends in this report. So last year, we released a series of 4 story maps that examined supply and demand for infant care in 4 states. Our work in these states supported the anecdotes that we were hearing when talking to our members. In the report, we highlight our findings through mapping, as well as work that's going on in Oklahoma to strengthen infant care using new CCDBG dollars. In addition to the map that we created highlighting the lack of childcare during non-standard hours in Massachusetts, we also recently released a report detailing low access to childcare during non-standard hours in our report called It's About Time, that was released in January of this year. We also highlight a concern that we have been hearing about from the field more recently, a decline in the number of childcare providers, specifically family childcare providers. We conducted some research about this in Arizona And Susan, our next speaker, can go into more detail about the work that her organization is conducting in their service territory. Finally, we elevate a best practice that we learned about from Child Care Aware of Kansas. They collect and report child care providers' desired capacity, as they find that this number mirrors the reality of how many children are actually in child care across the state as compared to licensed capacity. So in addition to the report that you received yesterday, you also received stories from CCR&Rs and state level advocacy organizations conducting child care supply and demand work. These are a members only benefit that provide greater detail into the supply and demand analysis, impacts and outcomes of this work, such as policy change or media attention, and some information about what is coming next in these states. Again, these are very solutions-focused documents that are intended for members to learn from your peers about how this work came to be. There will also be opportunities for peer-to-peer learning hosted by CCAOA, so stay tuned for more information about that. Next, I'm going to turn it over to our featured speaker, Dr. Susan Savage out of Child Care Resource Center.
Good morning or afternoon, depending upon where you are located. I'm Susan Savage, the Director of Research at Child Care Resource Center. We're a large R&R and AP agency in Southern California, serving Northern Los Angeles and all of San Bernardino counties. And we have embarked on a number of projects to look at supply and demand and the decrease in the supply of childcare. One in particular of the decrease in family childcare providers over time. And what we have found with family childcare decrease is that from 2007 to 2017, there was a significant decrease, 20% in the family childcare providers in our service area. And we had made the assumption that this was likely due to budget cuts, given the fact that the Great Recession happened during that period of time. And when we reached out to many childcare providers across the state, we did find out that two of the main reasons that they were thinking about closing or had closed were cuts to subsidy and reductions in the number of children enrolling in their program. I'm sure that's not news to anyone on the phone call, but it's always good to document these facts. And then what we have also found is that when you reduce the availability of family childcare homes in your communities, research shows that the folks who enroll in these types of programs are parents of color, parents with infants and toddlers, parents who have special language needs or cultural needs, special needs of their own children, and those working non-standard hours. And so when there's a reduction in these capacities, then we are reducing the access for these particular populations. What we have talked about doing to prevent this and come back with the supply is to look at targeted investments before universal investments. So thinking about targeted investments in infant toddler rates, increasing that. We've talked about how to look at increasing facilities. Currently there's availability of loans, changing that from loans to grants, reducing regulations for new facilities, etc. We have also looked at the deserts, regardless of family childcare or center. So both, we're finding deserts across our service area. Child Care Aware, many states have looked at child care deserts and found the same thing, that many people live in child care deserts. What we have found is that in California, research says that 60% of people live in child care deserts. But at our R&R AP agency, because we have the great capacity as everyone on the phone to look at our own data, we found that almost 70% of the people living in LA County, Northern LA County, live in a childcare desert. However, over 90% of the people living in San Bernardino County live in a childcare desert. That's astounding. What we've also found is that this differs by poverty, race, working non-standard hours, being a single mother, etc. So as you would guess, and you've probably read in other research, Latinos and African Americans are more likely to live in a childcare desert. Low-income people are more likely to live in a childcare desert. However, we found that is not the case in San Bernardino because most people are low income in San Bernardino County. So everyone lives in a desert because most people are low income in that particular community. If folks work non-standard hours, they're more likely to live in a childcare desert. So being able to drill into our own data gives us that ability to look at the fact that yes, California, 60% of folks live in childcare deserts. However, we need to target services into our communities because when you think about over 90% of people in San Bernardino County living in a childcare desert, that sends a very different message than 60%. And we need to really look at that particular community. What we have done as a next step is connecting with our local planning councils as well as the Advancement Project. They are wanting to take this research and bring it to legislators, to advocates, to funders, and they've asked me to create an equity lens around this research that will bring it to new audiences. I've also connected with kidsdata.org because they did a piece recently on childcare deserts and lack of access. We've also connected to media. And so originally folks might think that these groups that do needs assessment, et cetera, might be competition in a way, or why would you do childcare desert research if these other groups are doing it as well? The benefit is that you get to amplify the same message. So when we talk about factors such as the recent return of funding going to mostly preschool slots, mostly center-based care, we can work together in the same messaging to make policy changes if we're all working together with these different audiences who have access in different ways than how we have access at the R&R agency. And one analogy that I love from our former state superintendent is that if you have one pencil, you can break one pencil. However, if you put a group of pencils together, you cannot break them. And so being able to have our data along with what other groups are doing in terms of research in access, in lack of access in their communities, or at a statewide level, child care aware at a national level and specific states, you're able to really amplify your message in a new way. And what the R&R and alternative payment subsidy agencies, Head Start agencies have is that expertise, that special niche, because we have data from our own communities. We're able to talk to childcare providers and have a completely different lens than national or statewide researchers. And so being able to, again, dovetail, amplify that message, and bring that policy message to policymakers, the media, other research partners, you can make a greater impact than any one particular group all by themselves. Now, please feel free to look at these story maps. One of them, the family childcare map, has a voiceover that goes through the data. And so if you're not a fan of just looking at maps and data, you can listen to the voiceover. And then the other one is the childcare deserts map, where we drill into our specific communities. And the best thing to do at the end is you've got to have a message. Okay, this information is great. what do we do with it? What is that next policy step? So that's the critical component to end your message with. And feel free to ask questions either at the end, or you can send me an email with questions about this particular research and how you can use this, or how you'd like to learn how we use our research in policy relevant ways so that we can again amplify our message and dovetail and make a greater impact. Thank you.
Thanks so much, Susan. We really appreciate you sharing your story with our members and with our other folks on the phone. We just wanted to make a note in terms of just some nomenclature that we use. So our previous report was titled Childcare Deserts, Examining Developing Solutions to Childcare Supply and Demand. Here at CCAOA, we use the term gaps in childcare supply and demand, where we're looking at a spectrum of gap between licensed capacity and the demand for childcare. So just a note on that nomenclature, there is a write-up in the report that describes that a little bit further, but just in case some folks were wondering about the difference there. So with that, I'm going to turn it over to Jen Bump. And again, if you have any questions for Susan at the end, just send them in to us and we'll make sure to read them out at the end to get those answered.
Thank you so much, Maggie. And thank you, Susan, for sharing your CCR&Rs fantastic work. It was really, really fantastic. So in addition to shedding light on current trends and the gaps between supply and demand, the goal of this report is to highlight the current work of CCR&Rs around the country, and just as Susan said, to urge legislators, government officials, and community and business stakeholders to increase investment in CCR&R-led solutions. Next slide, Maggie. Okay, so similar to the 2018 cost of care report, in the recently released non-standard hours report, we devoted an entire section of this report to describe the role of CCR&Rs. While the strategies outlined in this report are not inclusive of all of the strategies that CCR&Rs use to address the shortages, we really intend for these to create a big picture view of what you can commonly see throughout the United States. So what you'll see in this report is that we've included some data points. These data points are part of interviews that were conducted with every state CCR&R network and 100% of local CCR&R program directors who completed a survey. And the data points are intended to support the narrative about the value of the nationwide CCR&R system. So here you'll see 2 examples of data included in the report, and these are really there to back the claim that CCR&Rs are at the forefront of recruitment and delivery of enhanced referral services. Throughout the report, we have examples and spotlights, obviously, of supply building, but we also point to enhanced referrals that are happening for all different populations. Next slide. Okay. So we really did, as I've mentioned, intend for this report to help you make a case for increased public and private investment in your CCR&R. So here's an example of the messaging that you'll find included in this report, just one example. The message that CCR&Rs are the primary drivers in supply building, and you'll find throughout the report these data points. So in the survey nationwide, we found that 84% of CCR&Rs at the local level are recruiting childcare programs. We found that 70%, 7 out of every 10, are working to increase the supply of infant toddler care. That's amazing. We have others working to recruit programs to participate in CCR&Rs. Most CCR&Rs are not only helping programs get started, but they're really helping them understand the licensing requirements. And then 72% of CCR&Rs are actively engaged in coaching and mentoring. And while it's not noted here, the survey found that 92% of local CCR&Rs offer on-site coaching. I'm sorry, on-site technical assistance. Next slide, Maggie, please. Okay, so if you're in the in an R&R system, I think the data that we show won't it won't be shocking, right? But it might cause some others to ask the question about so if CCR&Rs are engaged in this work, why do we still have this this supply crisis? And as you know, the answer to that is very complicated. But here's a data point that we think can help you gain some traction, and it might also help you explain a little bit about what the situation is. So the survey found that 100% of CCR&Rs around the country at the local level are funded with CCDBG dollars. The survey also found that 84% of CCR&Rs said that they have strategies to increase the supply. But when we asked if those CCR&Rs were receiving targeted public funding to support their recruitment work, only 44% said that that was the case. For this reason, you'll see that in this report, Child Care Aware of America is calling on legislators at all levels to take bold action to fully fund CCR&Rs. So even for those agencies who do have outreach specialists, I know, as well as you know, that you may have a very, very, very large service delivery area where the impact might not be as great as is needed to really bridge the gap between supply and demand. So as we talk about the report going forward, we want you to keep in mind that Child Care Aware of America's message really is to make sure that your work as R&Rs is funded, and that if you're currently receiving funding for the work, to be poised to explain what your impact could be with increased investment. Next slide, Maggie. So we won't use the chat feature for this question, but it is one where you could go ahead if you were interested in responding and raise your hand, and we can unmute you. If not, that's fine. We can go into the next section. But we wonder, with all this data in your hands, and again, our intent really is to not only create change at the federal level, but also to give you tools so that at the local and state level, you can gain some traction. We are curious about the kinds of strategies that you could use with this report to compel your state CCDF administrator to better capitalize on the R&R system or your R&R itself. So we'll let that sit for a minute. I think it is a question where it's complicated in states. We know that, but keep in mind it was designed with the intent that this report be used to make change in your state and to support your conversations.
Thanks, Jen.
So I don't see any. Yes.
Folks on the line, if you also want to type into the question box, we can also field those questions as well, if you don't feel like talking.
We can read them for you.
Yep, we can read them out loud for you. Awesome. So, and if you have some thoughts that you can to this question, feel free to type them into the question box and we can address them at the end as well. Awesome. Thank you so much, Jen. Now I'm going to speak, this is Lauren Robertson, the Digital Advocacy Manager. I'm going to speak briefly on the policy recommendations included in the report, but mostly and more deeply about thinking about messaging and how we can take this report and not just have it sit in our cubicle, but take it outside into the world, whether that be via press, via policymaker meetings, via social media. So I will be asking for folks to type things in the questions. So have your fingers ready at the keyboard. So the policy recommendations in the report are nothing new. You'll see nothing in there that'll surprise you, particularly at the federal policy level. We are really advocating, again, for higher levels of funding for CCDBG, which kind of sounds like our mantra at Child Care of America and probably in your offices as well. We're right now, last week, the CCDBG funding increase was approved in the Appropriations Committee, and now it's moving forward to the full House vote. So stay tuned on that. I'm sure you all have an ear to the ground on that. And we're at the federal level supporting, in general, legislation that invests in the workforce and family-friendly policies. So you can interpret that for specific policies or thinking about future policies as well. I really like the state and local policy recommendations because if you can see on the screen, a lot of these mention CCR&Rs explicitly in our policy recommendations, which is really exciting, and not just about that CCR&Rs will do things, but that they will be funded to do things, because we know that you all can't increase your data collection and increase your engagement with the community without money. So we're really excited to include those very specific recommendations for you all at the state and local level, and things will trickle down from the federal level as well. So keeping this all in mind, our policy recommendations, which you can read more deeply in the report, I want to spend the next couple of minutes to think about messages that you all hear about childcare supply and demand, and then how to leverage this report in response to those messages. We know when we are talking to the press or talking to a policymaker or their staff, or even sharing on social media and comments, we hear messages about supply and demand. So I would love if you are able, if you have some messages that stand out to you, what common messages do you hear about childcare supply? Maybe there are misconceptions, maybe they're myths, maybe they're true, but hard to combat with data. So if anyone has common messages, feel free to type them in. Don't worry, I have a couple on the next slide as well to talk about as well. All right, so here are a couple of messages I thought of, and if you think of any, feel free to type them in. These are by no means messages that everyone hears, and they're by no means messages that are universal or that mean the same thing across different states and localities. But these are particular messages that I've been hearing about supply and demand, and things that Jake, our policy manager, and I have been talking about on the Hill with folks, and also talking about with states. So these are just messages, and thinking about how can we counter these messages with the great work that's coming out of this report. So things like there are too many regulations. So like Susan mentioned, there are some regulations that don't make sense and that do stand as a barrier to creating supply. And we also know that there are regulations there to keep kids safe and healthy and keep their access to quality there. So thinking about messaging, how can you use this report to address myths like that, like there are too many regulations. It's a misconception, and how do you address that? I put providers are leaving the field for higher paying jobs. This is not a misconception. This is not a myth. This is true, and this is unfortunately affecting our supply because, like Susan mentioned again, family childcare providers are leaving. We're not funding systems to support family childcare providers. So how can we create supply when we have such a low paid workforce, low valued workforce? So this is a complete truth that you can use the report to really think about how to address this really unfortunate truth. And then this idea of states have to choose between quality and quantity. So we know that when we talk about childcare supply and demand, folks will say, well, just add slots or just increase ratios, build more childcare. And we know that it's not as easy as just creating slots and going from there. We know that while creating supply, we also have to ensure quality is embedded in that, and we also have to ensure that supply is not built on the backs of losing quality. So this is something specifically I've been dealing with in Arlington County in Virginia. So this is something I've had a personal connection to as well. So these are messages that I've literally talked to elected officials about, and I'm really excited to now use this report and bring it as an example of different things that folks are doing across the country to address myths, misconceptions, truths, and just hard realities about childcare supply and demand. So I put this in here to really think about when you are messaging this report and thinking about how you might bring it to an elected official or to the press. When we're talking about childcare supply and demand, we know we're not investing enough in families, providers, and infrastructure, whether that's physical infrastructure or policy infrastructure. And we know that we can't address supply without all three and many other things. So I really like thinking about this message when I was thinking about how I would take this report to a meeting on the Hill. How would I use the report to really frame that? I think there's some really key examples in there, and they range from small examples to small communities to larger, more statewide examples. And it's really about how CCR&Rs and other advocacy organizations are really using their access to data, to family and provider stories, and their knowledge of the field to address childcare supply and demand. So when we think about who needs to hear this message, I said both of these folks a lot. Elected officials need to hear this because they often hear not enough slots, not enough slots. And you all can bring this report and say, that's very true. Here are what real people are doing to address childcare supply and demand. We also know in the press often is talking about childcare supply. Childcare is unaffordable. How do we fix this problem? And they might not have the full story, right? They come into a community, they maybe interview a couple people, and they come up with a story. How do you utilize this report to really tell a broader story? And of course, we know that there are other folks who need to hear these messages. Jen Bump mentioned how state administrators need to hear these messages, and while they're not going to be hearing these messages in an advocating way where you're going out and advocating for a cause, you still can educate them using this report. So we have a few key ways that you can spread this message and use this report for good. So these are some bigger things, some things that can happen after the release on Thursday. They might take some time. They're not going to happen overnight. One of them is sharing the report with your elected officials. It might seem kind of like daunting to just send this to an elected official and be like, hey, look at this report, but we're sending it to all of the House and Senate because we think it's such an important document for them to see. Sharing it on social media is important too, and I think a really good message on social media is countering all these sad, I'm putting in quotation, sad stories about how expensive and inaccessible childcare is. And we can say this is a light at the end of that very dark tunnel, or a slight light to a broader picture. We've also created a customizable press release. So if your state is featured in this report, we encourage you to utilize this press release and customize it for your state. It's included in the handouts, I believe, in this webinar, but we'll also send it out afterwards. We also have our PR manager on hand as a resource for you. So if you're like, I want to get out this press release and I can, type in my state and stuff, but I need a little bit more about messaging or framing it for the specific audience, we are here for you to support you on that. If you're not featured in this report, I'm sure you are still doing amazing work, and I would encourage you to set up a meeting with your elected officials, whether that's state, local, or federal, and talk about this report with them and help them think about how they can address it as well from the policy perspective. And a simple way to include this report is to call on Congress to invest more in CCDBG. We're constantly talking about problems. This is a solution, and this report is a really great way to embed and ask for CCDBG. So now if you're like itching to go do things right away and you're like, I can't wait for Thursday, or okay, the press release is going to take a while, I want to do something right now, I do have a couple ways for you to take action right now. And they're really quick, easy, and painless. We're constantly trying to collect more experiences of folks who have been affected by a lack of childcare access. So if you know families or providers who can speak to their experiences on this, please send them this link and have them share their story. We also encourage you as CCR&R staff to share your experiences too. Your stories are important because you have so many different perspectives that we at the national level can't always capture for ourselves. We encourage you to look up who represents you so you can be ready to share that report on Thursday, and share that with your networks. A lot of folks don't even realize who represents them at the local level or at the state level. Elections are constantly happening, folks are changing. Figure out who represents you and send them an email, and then take action. You can take action right now on CCDBG. We are waiting for the full House vote, but you can still tell the full House and Senate that we want more money for CCDBG because we know that childcare supply and demand is so important and creating access is vital. So those are my quick and easy ways to take action, to really think about how you're going to message this report. I'd love, as you're going through the embargoed version of the report, thinking about how you could message this to different audiences. We're happy to have those conversations with you and help you develop more messages, whether that's sending an email, sending a tweet, or making that press release. I put this picture in here because this is from 2 weeks ago at Strolling Thunder, the Think Babies event. I love this because one, our logo is right in the middle, but it shows that we all have to do this together. It's multiple things coming together to address supply and demand, and leveraging this paper is really exciting because it is a paper with success and with positive forward-thinking ideas. And we're so proud of all of you for doing this amazing work, and we can't wait to see how you use it in the community. I'm passing it back over to Maggie.
Thanks so much, Lauren. So now if you have, if there are questions for any of the speakers today, please enter them into the question box and we'll read those out to you. We'll get you to the right person. If you don't have any questions today, feel free to email us. Our emails are on the last slide that we'll send out, but we are here for you. Share your stories of what's going on in your community, the work that you're doing. Which leads us to the what's next. The full release of the report will be on Thursday, so that embargo will be lifted at 10 a.m. on Thursday, and you'll get an additional email with that big embargo removed and the watermark gone, so you can send that out as Lauren and Jen have both illustrated. And we'll also have some peer learning opportunities for members for you all to learn from each other. We know that there are so many great examples of childcare supply building being done by our members, and we want you all to learn from each other so we all can advance the field together. So stay tuned for updates in our membership newsletter and on social media. Do we have any questions?
We don't, but folks, feel free to email us because I know sometimes it can feel daunting to type into a question box. So again, and one note is if you are interested in that state press release, Ray Ann is our PR manager. So happy to, she knows your emails are coming. So if you're interested in that, please feel free to reach out. All right.
Okay. So again, feel free to reach out to any of those emails on here, and we're happy to connect with you all. Again, our full report is coming out on Thursday, so keep an eye out in your inboxes for that. But otherwise, have a great rest of your day. Thanks for jumping on with us.